Addison's disease is due to adrenal cortex undersecretion, characterized by insufficient cortisol production, and the clinical manifestations of adrenal insufficiency include hyperpigmentation, sometimes called tan appearance, hyperkalemia, hypotension, that is low blood pressure, hypoglycemia, and poor stress tolerance. Now this is an NCLEX tip. The treatment options include administration of glucocorticoid steroids like hydrocortisone or prednisone. Remember, Addison for Addison's. Stress management is crucial. Teach patients to avoid stressful situations as much as possible. Let me give you an example of a question. The nurse is teaching a client with Addison's disease about stress management. Which statement by the client indicates a correct understanding of how to respond to physical or emotional stress? A. If I feel stressed, I will skip my evening dose of steroids to avoid side effects. B. I will double my steroid dose if I'm experiencing a cold or fever. C. I should limit salt intake during stressful situations. And then D. I will take my medication every other day to prevent dependency. The correct answer is B. I will double my steroid dose if I'm experiencing a cold or fever. Clients with Addison's disease have impaired cortisol production and cannot mount a normal stress response. During periods of physical stress, e.g. illness, fever, surgery, they may require increased dose of corticosteroids to prevent an Addisonian crisis, which is a life-threatening emergency. Skipping steroids increases the risk of adrenal crisis. Sodium may actually need to be maintained or increased, especially if aldosterone is deficient. Steroids must be taken consistently every day, not every other day, to maintain hormone balance and avoid crisis.